Hi, I'm David Levine. I'm co-chairman of Science Writers in New York. Behind the scenes is the other co-chairman of Science Writers in New York, Joe Bonner, who's taping this and we put it on YouTube. Our guest tonight is we've been very fortunate to have on several times, Dr. John Moore. He's a professor of microbiology and immunology at Weill Cornell Medicine. He's an expert on vaccine research. And most recently, he was one of 270 physicians, scientists, and healthcare workers who signed an open letter to Spotify, calling on Spotify to implement a better misinformation policy. The letter called out, in one show in particular, the Joe Rogan experience. The writers noted, by allowing the propagation of false and societal harmful assertions, Spotify is enabling its hosted media to damage public trust in scientific research and so down the credibility of data-driven guidance offered by medical professionals. And as I'm sure everyone in the audience is aware, joining the doctors was first Neil Young, who said you can choose between me and Joe Rogan, and he removed all his music. Joni Mitchell, Crosby, Stills and Nash have joined him, India Ari, and also Prince Harry and the former Meghan Markle have said they are thinking of leaving as well. And the Foo Fighters, they're all thinking about it, not formalized yet. So welcome, Dr. Moore. Thank you. So why did you write that letter? I mean, why did your group write that letter?
Well, the person who wrote that, and kudos to him, was Ben Ryan of Stanford University, a postdoc. He organized it.
Okay.
And circulated it, and many people signed it. It was easy to sign. I agreed with it and didn't expect a lot to happen, and was gratified that quite a bit seems to have happened about it. He also submitted a long document exposing why Malone, the anti-vaxxer guest on Joe Rogan, why he was wrong. He demolished it piece by piece, and many of us edited small sections of it and gave some input. But really, it's just down to Ben, and I think he's done a great thing, and it's part of what I think is now a mounting fight back against the disinformation movement. So I'm not going to use a lot of props, but look at the New York Times headline front page today. I'm old school, I still buy the newspaper. And what you see in that is there are more US deaths than in any other comparator developed Western democracy, if we're still a democracy. So we've done worse than anyone else. And that's true, particularly true in the Omicron wave, which is a dramatic difference between the next highest country on the list, which is Germany. And the reason is because we have the lowest vaccination rate of any of these countries, because we're still having around 2,500 to 2,500 deaths a day. And almost all of them are in unvaccinated people. So unvaccinated people are dying and vaccinated people are not. So why are more people not being vaccinated? And the answer is the pernicious influence of the anti-vaccine movement. So the anti-vaccine movement is quite literally killing people. And the anti-vaccine movement has two constituencies. There's an extreme left faction that believes that anything that's not natural shouldn't go in my body, believe in goop and all sorts of stuff, and hate anything that is a medical intervention from the pharmaceutical industry. That's one strand. I think they're a minority, but not insignificant. The other is extreme right wing, and they've been buying into propaganda from Republican politicians and fellow travelers for years now, for the duration of the pandemic. And it's getting worse because it's more and more dug in and more polarized. So there are implications for the pandemic because we'll still continue to see unvaccinated people dying at a very disproportionate level. But there are wider and long-term implications that are even scarier. As the number of people who believe in the anti-vaccine movement's myths and lies and distortions has gone through the roof during the pandemic. These guys have always been around, and I'll come to that in a while, but they've always been around, but they've got so much publicity and so many new recruits during the pandemic that this is going to have implications for years to come. And where it's going to hit hardest is childhood vaccination uptakes. We are going to see in the next few years an acceleration of an existing trend whereby more and more parents refuse to let their children have standard life-saving childhood vaccines. We will see resurgences of measles, diphtheria, German measles, mumps, all of the, the nasties that we were vaccinated against as children were never controversial and are now becoming part of this anti-vaccine vibe that is spreading throughout the States. So we're going to see a lot more dead kids and a lot more grieving parents for multiple years until they are scared by the death rate in their kids into changing their tune. By that time, it'll be too late for many of the kids who've already died. So we're going to see that. And the problem is exacerbated by the threats that are being made to public health officials. So public health officials, just for doing their jobs, are now targets for attacks, internet attacks, some case physical harassment. The head of Florida Public Health was recently suspended by that imbecilic Governor DeSantis for encouraging the staff in a public health department to be vaccinated. You might think that was his job. Well, he was disciplined by the governor for breaching a Florida regulation, which doesn't allow you to encourage people to be vaccinated. I mean, how perverse is this? So that kind of scenario is driving people away from public health and hindering recruitment to public health. The outcome's going to be terrible in the years to come. And it's entirely foreseeable, and it will happen unless there's a mass fight back and sanity then prevails. So that's how I see it. I think it's a pretty bad future for vaccination, and a pretty bad future for the kids who are going to die of it, let alone what's happening during the pandemic. So that's my sort of opening rant. I can expand on multiple points based on your questions and questions from the audience. There's a lot of ground to cover, and I'll certainly be willing to cover it.
Okay, so for those listening, if you have questions, please put them in the Q&A box and I will get to them. So in November 2021, the Kaiser Family Foundation issued a report that found COVID-19 misinformation was ubiquitous. They found that 78% of the public believes or was unsure about at least one false statement, and nearly a third believed at least 4 or 8 false statements tested. Furthermore, belief in misinformation was much more common among unvaccinated adults and Republicans. But they've also said that social media has a large source of misinformation. So besides Spotify, we have Facebook, Google, YouTube, Instagram, TikTok, and I'm sure Twitter, which they don't mention. But
yeah, all of that is true. I mean, the root of the problem is where you go to for your information. If you go to the New York Times, Washington Post, reliable media sources, science-based websites, you get accurate information. If you go to your granny's Facebook feed, if you go to Fox News, if you go to what somebody in the shop down the road told you over the garden fence, you're going to get junk. And an awful lot of it is around. And the more junk you believe, the more junk you're going to believe. If you have a conspiratorial mindset, you will believe anything and everything. And we've seen this throughout. I first came across this disinformation denial phenomenon 20 years ago with people who didn't believe that HIV caused AIDS. And in the early 2000s, their input affected public policy in South Africa under the Mbeki administration. And as a result, Mbeki wouldn't roll out antiretroviral drugs to South Africans who needed them, and 300,000 were estimated to have died unnecessarily. So that was kind of serious when you have disinformation and lies and distortions affecting public policy in a pretty well-developed country and leading to so many deaths. So groups of us assembled and fought back. And I was a member of a group tried to put accurate information out, tried to counter the denialists. In the end, that kind of fizzled out because a lot of those leading denialists actually died of AIDS. And so they removed themselves from the gene pool and removed themselves from being a problem for the rest of us. So that all fizzled out. But the mindset was that some of them were outright profiteers. So they had businesses that relied on people believing that if they bought their scented candles and listened to their aromatherapy and music therapy combo, that they would be cured of AIDS, and coffee enemas were a magical AIDS cure, all this kind of stuff. So they were making money out of the AIDS pandemic. And we're seeing exactly the same thing today with the anti-vaxxers, or with some of the leadership have businesses. And on those businesses, you can buy some useless garbage, but it brings them in millions. Alex Jones, who's not the biggest anti-vaxxer, but he's certainly out there, he makes millions of dollars a year selling, silver colloidal COVID cures. And then you've got the ivermectin movement, where a lot of people make a lot of money out of ivermectin. Middlemen, Facebook and eBay type sales grifters, pharmacists have been arrested or charged with essentially taking bribes to hand out relatively scarce ivermectin supplies to people who believe that horse deworming paste will prevent them getting COVID. So there's a lot of grifters out there, and they are part of the driving force. Then you find there are some just genuine nut jobs who believe in all sorts of really wacky stuff. And I mean, one of the leaders, Robert Kennedy, last weekend or weekend before last in DC, started ranting about Bill Gates tracking Americans via 5G networks and having 65,000 space satellites monitoring our every movement. Well, that alone demonstrates the guy's got serious mental issues. I mean, there's paranoia in there, there's cognitive dissonance, there's all sorts of weird psychological stuff going on. And he's one of the leaders of this movement. Then you get the Nazis who are out in force, and the anti-Semites. There were some amazingly obnoxious posters on display at that rally. And one of the reasons they do this, they've been doing this for years, they've been targeting Jewish Orthodox communities in New York City, have a low vaccine uptake rate for various reasons, but they've been targeted by white nationalists who would like to see Orthodox Jews die. I mean, that's part of their agenda. The anti-Semites, let's kill the Jews. And one of the reasons they try and disrupt Jewish society is by discouraging vaccination by spreading lies. That happened in Minneapolis, with a Somali community a few years ago, who were a major immigrant community, and the white nationalists didn't like black immigrants and targeted them with anti-vaccine propaganda and tried to make it a sick and kill their kids, basically. So, there's some real evil out there. And it's not just rogue scientists who have gone off the rails. There's real agendas in the anti-vaccine movement, and none of it is healthy.
Well, I just want to, Robert Kennedy is not a right-wing nut, but there are but he was also part of that group of people, and most of them were in California, who were against the MMR shot, saying it caused autism.
Absolutely.
And, people said to me, children have gotten so many vaccines, many more than we did as a child. And I said, have you ever seen pictures of people in the military who are getting 30 vaccines at once? As they walk down to, before they go off to Africa and then Afghanistan and all these things. And there's some, but there were measles outbreaks in California because people,
Yeah, well, it's the people who reject the notion that vaccination is an effective and safe way to protect yourself against diseases. It's this notion that you can overload the immune system. Look, 2,000 or 3,000 years ago, 5,000 years ago, we were living in caves. We were living in caves, surrounded by animals, and whatever animals leave behind them on the floor, our kids in that era were crawling around in. There wasn't a lot of disinfectants and soaps around, and kids our immune systems are trained at an early age to recognize pathogens. And they will, in that scenario, you receive a lot of pathogen, or a lot of viral and bacterial antigens. They're not all dangerous, but you're exposed to your environment at an age where the immune system is trained to recognize it, and you mature your immune system. One of the the problems with the ultra clean parents who sterilize everything because they think that cleanliness is next to godliness, and the only way to keep my child healthy is to not expose my child to any form of nasty substance. They're not doing their kids a favor, because at some point in their life, their kids are going to be exposed to these various bugs, as soon as they go to school. And yet that can be too late. I mean, the first 2 or 3 years of life is when your immune system is most capable of responding to these antigenic insults that it's better to get exposed in the first 2 or 3 years of life than when you go to school or when you're older, because that's how the immune system is set up. So vaccination early in life is an entirely reasonable thing to do. And yeah, sure, you don't want to get 5 vaccines in consecutive days for your kids. I mean, there comes a point when they don't want to have another needle in their arm. There's a sensible middle ground. And vaccine strategies are designed nowadays to help explore that middle ground. And getting MMR, which is 3 vaccines in one shot, is better for your kids and your own scheduling purposes than getting 3 different vaccines. The effect's the same, but it's more convenient to everybody involved. But the late 1990s, Andrew Wakefield in London essentially committed fraud and was thrown off the medical register and thrown out the science profession for claiming that the MMR vaccine causes autism. I read a book about that last year written by Brian Deere that just demolishes the entire story. But what did Wakefield do? He came to the States, and he's now an extremely wealthy man. I think he's now living in Texas. He became a guru for goop and goo and alternative remedies, and buy my stuff and everything will be great. And he just became a celeb among the section of the population that rose to the kind of garbage he was throwing out. So he's richer than anyone on this call, I would bet. I mean, he's a very, very wealthy individual nowadays through peddling pseudoscience. He's literally a quack.
So do you see this as, because I've written about this a couple of years ago about the anti-science movement, and do you see this as part of that?
Yeah, absolutely.
Yeah.
I mean, there is an anti-science movement in the States. There's a distrust in science. It's not taught as widely at school as it should be. There's people who are just suspicious of anything new. In some cases, they prefer to stick with time-honored religious traditions rather than explore what modern technology can bring you. There's all sorts of causes of all of this, but for sure there is an anti-science movement, and yet we all rely on science in every aspect of our daily life. Science, engineering, mathematics, technology. How do you think your car works? When you get on a plane, is that designed by somebody who's an anti-scientist or a scientist?
Well, I was at Lindau, the Nobel laureate weekend. One of the scientists was saying that that it's kind of selective. Like, people want to be on planes. They might be against vaccines, but they want to be on a plane that was designed by an engineer. They want to be on an elevator that is inspected. They want to be in a building that's up to code.
Absolutely.
Yeah.
And they'll believe all sorts of nonsense. Some of the stuff why take ivermectin or hydroxychloroquine because somebody's told you that it works when it doesn't? Well, that person told you that the best way for an airplane to take off is to reverse backwards down the runway, and you went and asked the pilot, I've heard on the internet that this plane is safer if you go take off in reverse. What do you think the reaction would be? If you say, well, I read on the internet that it's a really good way to build my carport is to use spaghetti and aluminium foil. I mean, the builder would laugh you out of court. But when you say all sorts of pseudo-medical nonsense that you've read on the internet, some physicians will actually give you that pseudo-medical nonsense. They will give you ivermectin. They will give you hydroxychloroquine. either because they themselves have gone down the same rabbit hole, or in some cases for the profit motive. And you know, one of the things that should be done in a fight back is for the AMA and local state medical authorities to strike these people, strike these physicians off the medical register, ban them from practicing, and particularly ones who refuse now to prescribe the FDA authorized effective drugs and instead tell their patients, no, I'm going to give you ivermectin instead. That's really running a risk of killing people. And that's not what physicians are supposed to do. And I think there's some serious repercussions should be taken out against these people.
So I saw a friend 2 days ago who said a new study came out of Japan that showed that ivermectin worked. And then just today I saw that it was retracted and Reuters,
Yeah, there's all sorts of stuff. There was one out of Brazil the other week, and it turns out to be complete rubbish, and PolitiFact did a demolition job on it. I mean, there are still trials going on. The NIH is paying for a very large trial of ivermectin. I mean, I personally wouldn't do it, but they're doing it. And, it's the same with hydroxychloroquine. Just because Trump thinks it was a miracle cure, a lot of people then automatically assumed it was because he was God to them.
All right, so I will take some questions. So far I have one, but what do you think happened to Dr. Robert Malone, who had a role in the development of mRNA technology, but now is speaking against the vaccines?
Well, I don't know him personally. I'd never heard of him. I've been in the vaccine field for 30 years. I had never heard of him before he surfaced in the anti-vaccine movement. So that kind of says he wasn't a big presence in our field. I mean, I literally never heard the name. So he says he was one of the inventors of mRNA technology. I think the real inventors of mRNA technology don't believe that he is. So it's easy to make the claim, he worked on mRNA maybe. I don't know what his true role was, but he's not accepted as the inventor of mRNA. That's a pretty grandiose, self-serving claim. I mean, I can only speculate. I don't know him. There is a certain genre of scientists, and indeed professionals in general, who at a certain point in the middle of their career realize that they're going nowhere. They go through a midlife crisis. Well, one way is you buy yourself a leather coat and a motorbike and go and do your midlife crisis thing. But some people seem psychologically wanting to take revenge against the profession that they didn't succeed in, that their failure couldn't be due to their own inadequacies. It had to be due to the system grinding them down. Or maybe that's what happened to him, that he felt the need to take revenge. Judy Mikovits, who did the Plandemic video in 2020, she was another one. She was prosecuted for financial fraud when running a research institute, and was obviously kind of lost her career because that's what happens when you do that. And her reaction was to lash out at anybody and everybody involved in what she saw as the demise of her career. Peter Duesberg, in the AIDS pandemic, he was a member of the National Academy and got into a professional argument in the late 1980s over some of the nuances of retroviruses with people like David Baltimore and other leading scientists of his peer group, his age range. And what became a professional dispute ended his career because he then adopted the premise that HIV could not be the cause of AIDS and got further and further into the conspiratorial actions. And he was a member of the National Academy and essentially went rogue. He lost his mind for all practical purposes. So this is not unique. I mean, think of the lawyers that we see behind the Stop the Steal movement. Think of, Giuliani was once a respected lawyer, if nothing else. Sidney Powell was had a reputation in the legal profession. There were other ones around, and now they're just complete psychos. I mean, they'll argue anything. They have no credibility. So at a certain point in some people's lives, they just lose it for whatever psychological reason. I think that's what happens to a subset of scientists, but it makes them very dangerous because the public doesn't know that they're spouting lunacy. They say, oh, he's a scientist, she's a scientist, that must be right. Well, scientists know that other scientists are often wrong, but members of the public don't have a way of discriminating. So they become heroes on the internet.
So what about what's going on around the world? Is it, I mean, is there, I mean, I know that because there have been riots in cities against mandates, there have been riots against vaccines, and riots against lockdowns. So is
Yeah.
this is going on, in Europe?
It's a global phenomenon. It's the same movements exist in Europe. There's, the internet is global. They all talk to each other. It's worse in the States, and that's reflected by our lower vaccine uptake numbers. But it exists in other Western democracies. I don't think there's a lot of it in China. It's kind of not tolerated. It's also true in Southern Africa. I've got friends in South Africa who have been dealing with their own local loonies. So yeah, it's a global problem, but it's worse here.
Well, I'm doing a story on Africa, and I spoke to someone in Nigeria. He said the vaccination rate there is only 4%, but he blames COVAX gives them vaccines that have 1 month left.
Yeah, that's a different problem.
Yeah.
I don't know whether in Nigeria there's a major anti-vaccine movement. I mean, over the years there have been lies spread that there were vaccinators for WHO shot by Boko Haram and the Taliban obviously in different countries. Because the rumor went round that a couple of rumors. One, that they were CIA spies, which had a certain root origin in, because the Osama bin Laden raid was informed by a fake vaccine collector who knocked on Osama's door and tried to get blood samples from the family. So there was an element of truth that there was an association with the CIA. Of course, innocent people were the ones who were shot. And there was also went around that it was an anti-Muslim plot to sterilize Muslim children and Muslim women and so on. So, it was a different form of lie, but it was a factor. So, but what can we do to fight back against it? I mean, I told you before that I was in this AIDS truth group, and in the 2008 period, we put up a website on our website. We put up a page, Denialists Who Died of AIDS, as a shock jock, as a shock tactic. And we got feedback that this actually was persuading some members of the public that there were serious negative consequences to believing the kind of rubbish that the leading denialists were perpetrating when they themselves were then going on to die of AIDS. Well, someone, I have no idea who, recently put up a website called sorryantivaxxers.com, and it lists now, I think, around 40 or 50 names of prominent anti-vaxxers who've died of COVID. Well, that's a shock tactic, but it might make people think, the COVID vaccines will kill you, and then 2 weeks later they're dead of COVID. And then some of their family members are grieving as a result. Others just say, "Oh, he died of lung cancer. It wasn't really COVID." So that's it's a tactic. It might persuade some people of the folly of their actions. I think the legal profession should get involved. I mean, words kill. I mean, the First Amendment isn't an absolute protection against words that kill people. I'd like to see some smart lawyers getting together with grieving family members who would be willing to testify that their husband or son died as a result of believing anti-vaccine propaganda, and take out a class action lawsuit against the leaders. I mean, Christ, we have lawyers who will sue anybody for anything in this country. Well, why not go out and do something publicly useful? And citizen activists can start to, in the Stop the Steal effort, the Justice Department's prosecutions have been well informed by internet sleuths who've seen the self-glorifying Facebook videos posted by insurrectionist rioters who, essentially convict themselves on Facebook. Well, there were a lot of tracking down and information sent to the Justice Department. Well, when you have public health officials who are getting anonymous threats on the internet or, in person, tracking the people down who are doing the threats and sending the information to the FBI, that would be a public citizen thing to do, a concerned citizen thing to do, if a mobilization of a group who take on the people who threaten public health officials. I'd like to see that happen.
So in the United States, I think we have like 63% of the people fully vaccinated.
Yeah, about that. I mean, I'm just looking at the New York Times. It says 64% fully vaccinated.
But
That's
that,
a lot of people who are not.
but that hasn't moved in months.
No, it's really not, because there is this really ultra hardcore that will never take a vaccine because they believe that it will turn you into a human magnet, that it will it affects women's fertility, that you can transmit a 5G ray to people around you and affect their health. I mean, it's just insane. And, you know, there are estimates now that between 150,000 and 200,000 Americans died in 2021 who were unvaccinated, who had refused to be vaccinated. This was after the vaccines became available. They believed the propaganda, and up to 200,000 of them died as a result of their folly. I mean, that's an American carnage.
The other thing is that the amount of people getting the third shot, the booster,
Yeah.
is not 63%.
No, it's much smaller. It's the same dynamic.
Yeah.
You know, and some of them are put off by minor sore arm side effects. Oh, I had a sore arm after my second shot, I'm not going to have a third. That's not quite the same thing. I'd also like to see, you know, we see on TV pretty gory adverts that try to put people off smoking. You know, we've all seen them. They're pretty nasty. You don't really want to watch them while you're having your dinner. No. But, you know, they're sufficiently nasty that they can be effective. Well, I'd like to see more public service announcements putting out the consequences of not being vaccinated and finishing up with a not a mask over your face, but a ventilator down your throat. I mean, again, designed deliberately to shock people into realizing that there are genuine consequences to being foolish.
Well, I know in like Israel, which is, you know, bellwether, they send out, there are 3 HMOs, everyone is a member of HMOs, and they send out emails saying it's time to get your vaccination.
Oh, sure.
But we don't have a central government doing that here.
No, we don't have a central government doing it. Some of the commercial, you know, CVS and Walgreens do. I had an email from a friend today wanting to know should they get dose 4 because a computer had misassigned them and something. But yeah, there's no central system, and certainly, you know, nudging and reminders. But the 30-odd% who will not take a vaccine won't respond to an email from Joe Biden. I mean, the only vacation I've taken in the last couple of years, I was out of the country, and I had a chat in a bar with a Texan dude. It was, you know, he's from Texas. We didn't have a lot in common. He was a Republican, and you know, but he was a civilized human being. You could have a conversation. We weren't going to agree, but we could talk. And he told me that he'd always been pro-vaccine throughout his life, and never had an issue with it. And in January 2021, when vaccine rollout started, he intended to get a vaccine. Then he saw Joe Biden on TV encouraging Americans to be vaccinated, and he instantly decided that he wouldn't, because he wouldn't do anything that Joe Biden asked him to do, because he hated Joe Biden and the Democrats. And so he wouldn't take a vaccine solely because of that. And then he said, well, you know, I wanted to go on this vacation, and to do that, I needed to get a vaccine certificate. So I went, oh, screw it. I went out and got the vaccine because I wanted the paperwork. Well, you know, push nudges work. He went out and got a vaccine because he couldn't travel internationally without the certification. And that was the only thing that changed his, you know, addled mind on, I'm not going to take it because Joe tells me to. I mean, come on. That's how crazy America is right now.
Well, I'm a tennis player, and of course, Novak Djokovic was saying that, you know, it was announced today that he is going to get vaccinated because he won't be able to play the French Open.
Yeah, well, he's going to get vaccinated, is he?
That's what the British paper is saying.
Well, doesn't mean to say it's right if it's in the British press.
Okay.
So he may not be Novavax Djokovic any longer. Well, you know, he was an appalling example. I had no sympathy with him whatsoever. I'm glad that Nadal took his record or whatever it was.
Yes, he did. And actually, the same British paper said that Nadal convinced him to get it, or maybe his winning. So I have some questions. I've encountered quite a few vaccinated people who say they don't need to receive.
Yeah, I saw that.
They've already had COVID. How does one address that?
Well, there's another one where you seek the middle ground. Rand Paul and his like are a menace on this, but there's also truth in the argument that infection will give you a significant degree of protection against reinfection, which is actually breaking down with Omicron, but then so is vaccination. So, but you look at the nuances on this. Firstly, infection-induced immunity wanes over time, just like vaccine-induced immunity does. So if you got infected in, May of 2020, you kind of decayed a bit by now. So I wouldn't be relying on that. A certain percentage of people only think they're infected. There was a study in the UK showing that 20% of PCR positive Britons in this study never developed an antibody response, while 10% of them approximately turned out to be false positive PCRs, which isn't, which happens. But the other 10% had only a local infection in their noses and throats and never seroconverted. And I've seen papers on this, so that's genuinely true. So, 10% of people may think they're infection protected and they're not. But, I think quite a few of us now think that a bona fide infection should class as the equivalent of your first vaccine dose. So and this has been not a new thing. So vaccination of infected people gives you a very substantially improved protection. You're an American, you want the best. Why not get the best you can get? Infection plus vaccination is a much more effective way of doing it. And the final, conflicting factor in all of this is if you only have a very mild infection, and in some cases asymptomatic or very mild infection, you may really not generate much of an immune response against it because you don't have enough virus exposure in your body. So, it's not that an infection response can often be very strong and very protective, but it isn't always. And so I always encourage people who are infected to go out and get vaccinated as well. But I think need one fewer dose. So, the booster would be dose 2 for an infected person.
So do you believe that Pfizer, Johnson & Johnson, Moderna are contributing enough to contest anti-vax propaganda? These companies have huge financial resources at their disposal.
Yeah, well, clearly they're not. There's an upside to that is that it's money. The downside to that is that the anti-vaxxer movement would just say, well, yes, the pharmaceutical company are bribing you to take their product and they know their product will harm you and it's tainted money, and look at all those scientists who are paid by our companies. So, yes and no. You can see the reaction to the pharmaceutical companies essentially promoting their products. I mean, it shouldn't be like that, but it's just, to me, it's obvious that was what the reaction would be.
Well, they have no hesitancy to advertise for other things.
I'm not defending the pharmaceutical industry. Believe me, I have a lot of reservations about how the pharmaceutical industry operates. I'm just not sure that tactic wouldn't rebound against them or against the goal.
Okay.
The federal government should be doing more, but then Republicans don't listen to anything Joe Biden and his administration says. So and as soon as Trump sort of embraced vaccines, he got hammered from the right of Trump. I mean, it does exist apparently.
Yeah. Yes, he said he got his he got his booster shot.
Yeah, and got booed for it. I mean, where are we? I mean, Trump is some kind of pinko lefty.
So I have to ask this question because it's from my father's wife. I had a booster at the end of August, but antibodies test results show if I should get a second booster. I'm in my 80s, not immune compromised, but a cancer survivor. And I have many friends asking the same question.
Well, anyone who's immunocompromised is absolutely already entitled, FDA approved, CDC approved, to a fourth shot. And the definition of immunocompromise is really between you and your physician. So physicians should give guidance on that. But in some cases, it's just a no-brainer. I mean, there are many forms of blood cancers that causes immunocompromise. people who have a kidney transplant recipients who take anti-rejection drugs. Those anti-rejection drugs often take out, or usually will take out, your ability to respond to vaccination. Other conditions are milder. I mean, RA has some immunocompromise associated with it. It's not as severe as others. So that's between you and your physician. And anyone who's immunocompromised by, consultation with a physician or real knowledge is entitled to a fourth dose.
So do they have to get a prescription from their doctor to get the fourth dose?
I don't believe it's done by prescription. I don't think so, but I probably should know this. I think if you just turn up at CVS or Walgreens or something, they may ask for some proof of eligibility. I'm not sure. I'd have to go and look it up.
Okay. So I don't have any open questions. So I do want to ask though, what more could, okay, so, science writers in New York, what can science writers be doing besides reporting the truth to really encourage people to get vaccinated?
Well, you see, the problem is the problem section of the population don't read what you write.
Right.
I mean, we're all preaching to the choir. I mean, people, the circles I operate in stick editorials in New York Times and Washington Post and left-wing websites and so forth, and they're not read by the problem area. They're just, and I've written a few editorials, kind of in your faces on the Daily Caller and Smerconish, which are centrist or right of center, but they're not that widely read. And nobody gets invited onto Fox News to, rip Hannity a new arsehole or anything like that. They just don't want to go and hear anybody who would tell Hannity what he is, and Tucker Carlson. They don't want to know. They're not interested. So I don't know. Writing alone, it's not sufficient. I'd like to see real mobilization of the citizenry. As I mentioned, lawyers suing the anti-vaccine leadership on behalf of not just the people who die of COVID, but if you're unvaccinated and recover from the ICU, you're going to have a freaking horrendous medical bill. Somebody, and if that's because you've been persuaded not to be vaccinated by the anti-vaccine leadership or specific named anti-vaxxers, to me that's a lawsuit, and lawyers should go in there. As I mentioned, I'd like to see more aggressive PSAs. I'd like to see the medical profession go in and jump down the throats of the quack physicians who prescribe ivermectin. I mean, something should change. I mean, I don't have all the answers. I mean, we talk about it a lot, and there's no simple answer, but doing nothing is going to lead to what I started off this rant by saying, that we're going to see a substantial decrease in childhood vaccine uptake in the coming years. Just watch. And you have governors of some Republican states who they have childhood vaccine mandates, and it's perfectly normal, but they won't mandate vaccines for COVID vaccines because that would be an insult on the freedom of the parents to choose. But they have school age vaccine mandates in the same states for MMR and etc. I mean, the hypocrisy is completely ridiculous.
It kind of reminds me, there was a Woody Allen movie where he was told, his friend said, there's going to be a neo-Nazi rally. Someone should write an op-ed in the New York Times. He said, that's not really good for Nazis. Someone should go down there with bats and sticks to kind of take them on. And that's what I kind of feel. It's not really working. I heard today that, they're hoping to authorize vaccines for 6 months to 3 years old. And they did a survey of parents that only 33% of parents said they would vaccinate their kids right away. They want to wait and see.
The same survey.
They want to wait and see what happens.
Understandably, parents are nervous and they want to see some other kids go first. I mean, you get that. I mean, there's a human nature element to this. But, why are they nervous? Because they've heard all sorts of stuff from other parents, from mummynetwork.com, and a lot of it is just misinformation and lies.
So should future research into vaccine development include simultaneous research into how to introduce the new vaccine to the public?
Yeah,
I can say something about that because
yeah, sure, go on.
when I was at the American Cancer Society, we expected a lot of opposition to the HPV vaccine,
Sure.
and it was positioned as a vaccine against cancer, and we did not get the tremendous opposition we wanted. We expected because of that positioning. It was hard to go against the vaccine, the first vaccine against cancer. But I'll let you answer the question.
Well, hopefully we won't need to develop another pandemic vaccine for the next few years. You know, look, no one had time in 2020 to think about this. The urgency was to develop a vaccine. And you know, yeah, I was aware the anti-vaccine movement was around, and I'm sure everybody was aware it was around, but I don't think anyone anticipated the magnitude of the problem we face today. I mean, I knew there would be some refusers, there always are, but if you told me that 30% of Americans, I mean, 50, 75 million people would buy into this, choose your word appropriately, I wouldn't have believed you, not in 2020. I thought that the shock of the pandemic would have overwhelmed any resistance to being vaccinated against it.
Well, I interviewed a few months ago a person who wrote about the Operation Warp Speed, and he said they were always surprised that the Trump administration, this is one of their crowning glory achievements. They developed a vaccine within a year, and yet they're the same Trump supporters are the ones who are against the vaccine.
Sure.
Yeah.
Well, you're asking me to say whether the Trump supporters are rational human beings or not. Yeah, I mean, who knows what went through their minds. There came a point at when disinformation went around and outweighed the risk of the pandemic. There must have been a month or two when this really took off. And I don't recall a specific triggering event. But at some point in the pandemic, America went from needing and embracing a vaccine to a large number of people rejecting it. And I don't know, was it the change of administration? Was it that, as I said about that guy in Texas, was it because Joe Biden was telling me to get the vaccine? I mean, is it the political polarization? Is it because Democrats rolled the vaccine out and therefore Republicans didn't want to embrace it?
Well, when it first came out in Florida, there were very, very long lines. They showed them on television.
Well, 2/3 of the people, I mean, the top population embrace it. Right. So yeah, there are a lot of vaccine enthusiasts. I mean, there are some emails I get from people who seem to want a vaccine dose a day. I mean, a dose a day keeps the virus away. I mean, you know what I mean. But there are vaccine enthusiasts who can't get too much of it, and they numerically outbalance the resistors. But the resistors, there's a lot of them around.
Someone told me they know of a person who had 3 doses of Pfizer, 3 doses of Moderna. Then a friend of mine said he was in Hong Kong and he got the Chinese vaccine and he got the 2 mRNA vaccines. And when he came to New York, he got the Johnson & Johnson vaccine.
Well, I mean, there comes a point when that's just silly. I mean, yes, if you got the Chinese vaccines, you definitely need an mRNA boost. That is sensible. But, going through the whole, vaccine bingo, I've now got everyone on the planet. Yeah, I kind of wouldn't go there, but the Chinese vaccines are not great.
So I wanted to ask you, I know you were involved in the clinical trials of Novavax, and what's happening with that?
Well, I was.
Okay.
Well, Novavax is a very good vaccine, in my opinion. And it filed on Monday its EUA, finally filed its EUA. And I assume the FDA will review and approve that in the next, 4 to 6 weeks. Usually takes that long for an EUA to get reviewed. And unless they've really screwed up on their EUA application, you don't expect it to get approved because it was 90% effective its antibody response is at least as good as Pfizer's. I mean, I read a paper about that today. It's as good as Pfizer's. So it's a very good vaccine, in my opinion. It's not reactogenic. I mean, not to the same extent that the mRNAs are, and it can be shipped at 4 degrees, which is, a rollout bonus. I mean, it's certainly easier to distribute a vaccine on ice than frozen. So it would potentially be useful as a booster down the road. I mean, there aren't going to be many people who, in the vaccine resistant community, who are suddenly going to go and embrace a spike protein vaccine. They might, but I don't think it'd be many.
So let's talk about the fourth booster, which Israel is giving to people. I think a couple of European countries are giving to people. Do you see that as happening here at some point?
Yeah, definite maybe at some point. I don't think it's justified at the moment.
Okay. And what about the booster that Pfizer and Moderna said will be ready at the end of March for the Omicron variant?
Yeah, let's see what the results are like. I think it's absolutely worth testing the Omicron booster. I mean, I'm talking to reporters about this today. So, but it's not going to be available before the end of March. So what's the state of the Omicron wave going to be around the time the vaccine becomes available? I mean, if the Omicron wave nationally subsides at the rate it's doing it in New York, there may not be many infections with Omicron going around at that time. So will Omicron come back? Will a more the 2021 lineages of viruses come back? Will something else come back? This is where you can't see the future. Having an Omicron booster available, but not necessarily rolling it out, might be a useful thing to have. So, the downside of Omicron boosters is this. I mean, if you're a naive person, I mean, you've had no antigen exposure, no infection, no vaccination, and you're vaccinated with Omicron, you're going to have a very narrow specificity immune response. It will deal with Omicron, but it will not hit, Alpha or Delta or the earlier variants, not very well, because Omicron is so different. What happens when an Omicron booster is given to a previously vaccinated or infected person? That's what we have to wait and see. That's where you can only make predictions, and it's a bit wiggly. So let's see what the data look like. So a combination of the trial data plus the trajectory of the pandemic at the time the vaccine becomes available will be the decision-taking metrics as to whether we need to roll one out or not.
So this is from actually a friend of mine from high school. So asking, would you speculate what the next wave of COVID could be? Weaker or harsher?
Oh God, I wish we knew. Will there be a next wave? Will it be better? Will it be worse? There are opinions on this are a dime a dozen. I mean, the worst case scenario, which is neither impossible nor inevitable, is that Omicron becomes more virulent. So the principal distinguishing feature of Omicron is that it has lost its ability to replicate efficiently in the lungs, which means it isn't killing people to anywhere near the same extent. It doesn't mean it's a pussycat in unvaccinated people, but it's causing relatively mild infections of the upper respiratory tract, the nose and the throat, but it doesn't penetrate into the lungs very well. And that's a good thing. And we understand why this is on a molecular level. And it is not impossible to see Omicron reacquire the property that enables it to replicate in the lung. Then you'd have a highly transmissible, antibody-resistant, lethal virus. That is not a good outcome. Now, I'm not saying that's going to happen. I'm saying it's not impossible. That's the worst case scenario. Best case scenario is Omicron just vanishes and we don't talk about it again, and nothing else comes back. Another possibility is that a Delta-like virus will take off again, and we'll have another wave of Delta-like infections, which were not good. I mean, if Omicron hadn't happened, we would have seen a Delta wave that peaked in mid-January and killed a lot of Americans. I mean, perhaps the same number, And we replace the devil you know by the devil you don't. So, speculation, it's just, buy me a crystal ball that works and I'll tell you the future. Honestly, none of us really knows. You hear, this word endemicity. Endemicity is being thrown around. And there was a very, very good article in The Atlantic from Katie Wu this week. And she writes brilliant articles on what does endemicity really mean. And I read that and I learned from that article. I mean, I learned from a lot of Katie's stuff. She's terrific. But there's a very, very good article on what does endemicity really mean. I mean, TB is an endemic pathogen, but you wouldn't want to have it. HIV is an endemic pathogen. Endemic doesn't mean benign.
All right, so I'm going to let you go. On February 8th, there'll be, I'm going to have a conversation with Dr. Carl Eric Fisher, who's the author of Urge or History of Addiction. He's a doctor who was hospitalized for addiction. And that talk will be at noon because he's in Europe right now. So my European friends can watch it at a reasonable hour. And I hope everyone can also use their lunch hour to do that. So I think there might be a question. No, that's it. So anyway, Dr. Moore, thank you so much for being on the show. And is there anything you think we can do to help you out, to spread misinformation? We're happy to do it.
Talk the truth to people who need the truth talking to them. Do your best.
Okay. Well, thank you again. It's always nice to see you. And everyone out there, stay healthy. And we'll talk to you soon. Okay, take care.
Okay, bye-bye then.